Welcome, everyone. Thank you for joining us for the webinar today. My name is Gina Breinig, and I work in the Health Promotion Department at the Health Plan. We believe each person's well-being is multidimensional, going beyond just physical health, which is why our wellness program focuses on 8 dimensions: emotional, environmental, social, spiritual, personal, professional, nutritional, financial, and physical. We are excited to offer a number of short educational videos on these dimensions and hope you're able to gain new knowledge and motivation to help you continue on your own journey to optimal well-being. Before we get started today, first some housekeeping items. We have everyone in listen-only mode for best sound quality, but there is a chat feature you can use to submit any questions. We will compile all the questions and send them out with responses to everyone after the webinar. This webinar is being recorded, so for those who are listening to the recording, there's an email at the end of the presentation where you can submit any questions. And now I'd like to introduce Abigail Ninneman, who will be speaking about compassion fatigue, a topic in our emotional dimension. Abigail has nearly 10 years working with schools and healthcare. She has a master's degree in counseling education with a school emphasis. Abigail's passion for working with people and addressing social determinants of health has led her to pursuing a second master's degree in social work. She has been a part of implementing many policies and programs in the healthcare setting, and she is currently a health transformation consultant with the Health Promotion Department. Thank you, Abigail, for sharing your information and your time with us today.
Thank you, Gina, and thank you for joining to hear about compassion fatigue. So the objectives of this presentation are to help you understand what compassion fatigue is, also to recognize the symptoms in yourself and your coworkers and others around you, and to have strategies to combat compassion fatigue if and when you recognize it in yourself or others. So what is compassion fatigue? So compassion fatigue is also known as vicarious and or secondary trauma. So we're not going to go into detail about those. That could be a whole other presentation potentially. But vicarious and secondary trauma are traumas or events that we indirectly experience. So this often occurs by hearing someone's story or hearing similar stories over and over and over and over again. The dictionary defines compassion fatigue as the physical and mental exhaustion and emotional withdrawal experienced by those who care for sick or traumatized people over an extended period of time. So compassion fatigue is not burnout, it's different. So burnout is typically caused by everyday work stress, like getting prior authorizations, making treatment choices, and technology issues. So it's different because compassion fatigue results from taking on the emotional burden of a patient or client's agony. Compassion fatigue can be an occupational hazard for anybody who is caring for individuals, but compassion fatigue is not when you're just tired of being nice. So what are the risk factors of compassion fatigue? So as mentioned in the previous slide, compassion fatigue is and can be an occupational hazard for anyone in a caregiving role. This can happen at work or even when you're at home caring for a family or friend. So, some risk factors of compassion fatigue. Some risk factors are the ongoing and degree of exposure to traumatic events or material. Also, being a frontline worker is a risk factor. So, a police officer, a healthcare worker, other first responders, child protective services. When you're the first one on the scene or you're the first one assessing a situation, that can be a risk factor. We all have potential vulnerability if we are a caring person and care for people. If you were taught at an early age to care for the needs of others before caring for the needs of yourself, that's also a risk factor. Another risk factor can be the lack of inexperience in the field or newer to the workforce for that type of work. So if you're new and not sure where to get consultation or how to handle a situation, that can be a risk factor as well. And last but not least, neglecting our own self-care need is a risk factor. If your ongoing self-care practices are absent from your life, you're at greater risk for compassion fatigue. So it's important for an individual or person to be able to recognize compassion fatigue in themselves or others, like their coworkers or family members. So some symptoms of compassion fatigue that you might see in yourself are blaming, bottling up emotions, substance abuse, sadness and grief, fatigue, also lack of sleep, poor concentration, focus and judgment, and self-care. But it's also important for supervisors or coworkers to notice symptoms of compassion fatigue in the workforce. There are many symptoms that can impact the organization or company. These are high absenteeisms, so if you call in sick a lot, or coworkers, a lot of no-shows, even leaving work early, and the inability for staff to work together or complete tasks on time. So if your coworkers or supervisees are distracted on their phone a lot, not really working on a task at hand, that can also be a symptom. And then constant negative attitudes towards management or supervisors can also be a symptom. So the effects of compassion fatigue can be long-term if not addressed when we see these signs or symptoms. The effects can be reduced empathy towards people we work with or patients or clients or members, but also towards coworkers. A reduced sense of self-control, hopelessness, even chronic overeating or drug and alcohol use. You might not know that you have compassion fatigue, so it's helpful to know the symptoms, but what you do know is something is wrong and you just don't feel like yourself anymore. There is a helpful tool. It's the Professional Quality of Life Scale, Compassion, Satisfaction, and Compassion Fatigue version, and it's a tool that you can use to check in with yourself. So in order to combat compassion fatigue, it's important that we manage what we carry. So think about what is important to you. What's the most important thing to you in your life? So most people think or would respond and say their family, friends, kids, significant others, maybe a pet. But really the most important thing to yourself should be you. You need to be the most important thing that you think about. If you can't take care of yourself, how will you take care of others? This is similar to the putting on the oxygen mask on the airplane analogy. You have to put it on yourself before you put it on others. So take care of yourself before you can take care of other people. So some helpful self-care, or what is self-care? It's an important skill to maintain. It's not something that we're ever taught in school or in the workforce. It's also hard to manage it in our day-to-day life. And self-care is important to prevent burnout. It really means that we're ensuring that all of our needs are met. So those 8 dimensions of well-being that were mentioned at the very beginning, so things like our physical, social, mental, emotionally, spiritual, and professional needs. So what can we do for self-care? So some ways to take care of yourself are to be kind to yourself and give yourself grace. Also, enhance your awareness with education. So that could be these Zoom presentations, just like we're giving now, or working closely with your coworkers to create consultation or check-ins when you have difficult situations. But even checking in with your family or significant other and let them know how you are feeling. It's important to even name your feelings and let either your coworkers know or your family know what feelings you're having and kind of where you are at. Some other self-care strategies are to clarify your personal boundaries. So find out what does and doesn't work for you. It might take some time. It's going to be a lot of trial and error, but name your boundaries out loud. Name them with your coworkers, name them with your families, and have an open conversation about it. One other strategy is to make a positive change in your environment, even just one small positive change. So bring in a plant, make sure you take your lunch away from your desk, or give yourself that 15-minute break in your day. And lastly, you can always utilize your employee assistance program at work and your supervisor. Thank you for listening to the presentation today on compassion fatigue. I hope you learned something new and walked away with one helpful tip.
Thank you, Abigail, for that great information. And thank you to everyone who has attended today. If you have any further questions, please send us an email. Thanks again and have a great day.